otherwise yung marklabo ko yung ilsil merkaw Lawrence ng Rilbelaw 87.9 Igo Paradise FM el al chils yung kotlagab singila ong etiul buil September 1st tulong edel urior temela press conference rigid ma poko aisra bululu asya obengel nga press conference luabek el temel ngani His Excellency Surang Swift Junior President Rablur Belaw direct lang artiang Vice President el Ministerio de Justice el atangakal Che Udu Senior ma direct el tigel bebida Ministerio ngania a Ministerio of Public Infrastructure and Industries el atangakal Charles E.R. Obiang ma direct el Ministerio of Finance el atangakal Gaileb Udoy Junior ma Ministerio HRCTD el atangakal Ngiray Blast Matul ma Ministerio Agriculture, Fisheries and Environment el atangakal Stephen Victor ma direct el Ministerio de Education el atangakal Dale Chengins mengel miltut kulmo Ministerio Eli di dirakal meedal Ministerio State el Gustav Aitaro ngartiang ngartil vital teblo mengel ngasegil el end ma Mr. Gafaru Erbelaw nga EOC Deputy Incident Commander ma ngel Dr. Ten Hengara CDC ngel CDC Medical Epidemiologist ma ngar bitar nga ka adira ibail mispenita darong kagida mo miskida nga ang lungu nga dira ka chairperson rap Belaw Cancer Society akmalingi tringi mo miskida ang lungu el tutaw ma kumongo yung numsang
malungil tuta ko nung atay el mereng asule la Dios el ngara tigingel madungura abu kara Yoel Prophet Yoel el 2:21 and was say fear not O land be glad and rejoice for the Lord has done great things ndira ka ngara tigingel Yohanes 16:33 and was say I have said this to you that in me you may have peace. In the world you have tribulation, but be of good cheer. I have overcome the world. Poligay gidya ang lungu ede o dang sedar el altutaw. Rubakal Dios, agi maral mereng asulem, maral dang sarkaw. Maral wase ubul Dios el matililak langar, ngawa klisiam, gawa mga daredra kamam, gawa ola bay ke rogul nganir kamam. Magi mergar el altuta rogui togubet el alsigang el time Dios sertiral tira mutling el tel bluma mel belaw mo oldar sertir rogui le korkaw logi tiang lunguam el wasel Dios kamaral ubul Dios kamaral masaul agi mereng asulem el gerel el alsil selbol segi diang lunguam meruwa kala se lagi bagi lagi madakta lengkaul Dios a obang gamam ikaw ang mga dredele, ikaw ola baklisi, irayang mga utom. Agi merkaru bagay mal mo to ubet slo other siya president kama meruwakal surang Luis Junior, ma vice president. Tira rogul tira, obanggele rubakal lola nga sewel mga tmok kartel blumam. Agi merkawe olingit tersel el got el ngarabab el bud el ngarakal merkamam, hindi akal bud el ngartel blulap. Bolsa el meliwak kartile o banterira be kalsils el ngosu ko mamra igel ngi amata arbusul el meringal yakmal ngaru eruba telgim albang ringir el alsils el maral mo agi merkaw mal diodar si el alsils el togubets el got el gabsingila ong etil buil el wasebom other dari el mo nguaw la pangal el albuil rara kara 2021 poli ka idang lunga me odang samle korkar el altutaw ega mal masaul yakyodar sel ngarang claim kaul Dios el adam ma Dios el ngal ma Dios el edaw rengal mga dare dara ulme el almurar bolo I say amen.
Mang masawla dira ibera malungin lungu el time presidente bok nga ulgyong muskaw bomdu el dadam.
مريزين مالويل توتا الأولى روما تعال سوسراي بدول مرقلاي مربوغول بيلاو بيلون مبيرقلاي مرمسيل بيلاو President Senate Hokons Paules marugul senators Speaker Sabino Anastasio marugul delegates governors, speakers, mga lectors, mga bekal adar ng pelaw, mga utsyarigin mora ang ayangan kutok milti abalu mga rekre abalur belaw kita mal al mereng asula la adirai bai rang lu el ma te el la mungada al tuta mal mereng asula Dios ini aku mera sa mga tara belwat om le urgi dra bekal sil sem sulang sen lu kita nga kutlu le el al sil sen tugubet sil se adirai bai kada mo sign el proclamation or el kirela cancer awareness kidam dengel wase ablur bela wa tara doctor yano gim ngara meeting ra HF wase te ya gotel ol sera other bela el al sils seldo mesegel statistics ra other mura guru especially sel sum temlameu del mom dangali en ada kabol tarra etmo de busara dron mangmaral close to telela adol sis akrar at tomstria ung information mal bol kargi ngara kensang waise bo bol ngara check up ele ngari ado ngurgi del se del lombe martiarak traw alel mutamri adal mura gurun mung seil mgatakatar bange ndi of course diri algi adram klat gido singana igel dorul diri gal gum qado masadala indiri kan wasugid man deqda sis bari example Ramai nasi hotel tara hotel klolu ula agasi noma auspela tokol. In fact to seng ogim emel basen tara igel lula agasi noma omura tokora tokol. Diregal I'm sorry. I say yeah 22% aray gaya del uk kasi noma diregal uk omur because ra akal del bu. ماشي أغدل باسنت هذا ما سيل breast مالوبين cervical cancer ما أقول عاري يجيل ويل الدهور جدري الآن الدولا بالشيكم كذا مال مال أربك لا وسيبو بقول عاري جنسان بقول شيك مال دي لونيل دون تيجي التايم باي ده ساين تاع proclamation هذا دول مول بقول ترى ده رايبان ما ده saying the proclamation oh triade Pemgir oh dime dia malu lam tu sese oh I saying first cancer awareness mande kulit terakhir aiba yang boldu saya mal mosel mai garga awai awai
Soblate ala president ma kami rogul ngatnyang akmal di mo so akal di o ay salwase cancer awareness man da umurel alsil sel molmutra ula pangalel ako marala segi the rogu yal one or two or even many people klangar ka tulungal gargidam amla affected at tegi del ser nga ka I for one and dak aksel kasi no man dinga ni pasyon na kalgirel telurior so kalol nga sew mga ngigel bato kal activity el makatmok kar el albuil man so mamel di mo announce sa radio ako talgi pom ururing mo so is para radio el al Friday edi so kaldi mertiang maldi o ay salwasagi mga sulel la buhay igel niya support edi nga ngartiang olgi tala sa bolsa president el ngosuma malgire la igel el maral mo activity lo mo ora Friday el mo trasel sel mo orgil September 28 ang mo niya wakathon mo niya candlelight vigil el mo malat kartirgero ko el tiram la mosmera agi dire nga president el kanek tulo banggela Coro State Government omda sa lasel sa elegi bom maano resegi deleng komedengela sa staff for the odalak ladi mo tulang klel lang mle kongil mo so is ngar al adra Belau Cancer Society los dirgam los mera. Manggel imo nga ngara Lor Hawaii, Asyon Pedro. Mang soma mo connect dal more families. Mo usper sige dal sil salway yalbol Tokuwet sel mo recognize remember tir ma family tir and then of course all of us el mo remember tir tigi del sil sel el manal mo maktingul meritang emal mo mga saula akapira programa gibla mo mister at radio station na T88A matobang matamtang ali makadi mo kanik trudi wala el boritang ko mal masauro ko
Ma'am Sulang.
Egi olingit egi exit kami continue.
I see.
Sulang.
Ma'am Sulang. Direkal elal nombre gal wige potuluro gal no se del ok maya tele del joiner cell meeting rigidra seeds lo mangela FAO. Lo masado la sengara igel igida se del mot magal mokal increase rawa tokora food security ma tokora au mga ledara ay gal yun sirigit. Uri urse direkal elal wige ng kanit sel domosang Micronesian President Summit. Mang nungun mo eli tiablo sa 11 o'clock makwa di mawon ri do sa 11 o'clock modibus. Okay. Mang daw ko da question ri tia sel mlegira del morana rundi because of COVID da uktim runi through Zoom. Mang mle eli ras umura 11 o'clock elang mutra umura 11 o'clock maklo mutra umura 11 o'clock. Mang kadire ka logi usegi de waisra adra blue lo ase man ngal tanga temra sula ada senate tira mlo sabrari el kongera nominee ra Mr. Aitaron mo minister of state man mga sula la senate of course el albal wa gingaleng dire prospera mul support ra adra blue mo dal mol mlom sa support nga of course nga dir goro la mga ngara ministry of state maulang ngartelo banget dia mokte karida ongi mulurior tru klokora tutau mori official mungeda or sen dimla olbira kadular oreo oda dire kamal dar arbe klat metme join ke set time elal itasil se ega dire kal after MPS meeting adok morngarad ana igel betokol project el unot mokla presenter mo saw madar ngabo dal algia o kire regal balur bela mlamo merek dire kal klot tutre la dona surir trigel tira ulunga seorgid especially blura Taiwan magadamo ribbon cutting ra ngar ok la fountain youth project moria dire kal ribbon cutting ra ngar the state road paving project ngara all moria dire kal nga klaw limang road paving project ribbon cutting ma alap limang road paving project Direkal Morisel ribbon cutting at a Quabs Park, my parking lot improvement. Direkal project ra ukniwan. Hindi adel bulu adorur la gamal betom gimle uktispeta sa turu la kaldel bulu la mangarar ngiwal mamal gayo. Maria seluk at ngara ngiwal state compact connecting road project. Madrigal ngiwal housing area road paving project ay bodo o mesra el alsit sera blur giwan ya ukmal kayo kan dire kal rael el morsel dispensary so kada atsumari adra yel blur meng said join a gidra yidel el ribbon cutting agam omura ay gidel taklo na itasils dire kal eli ay mloni atelet el mora mo visitors el team ra project recovery aurel maral alnia triganga ngarbelau el nomesa el skogira soldar adram rigel nia amil tamal sera ongerul makamal misera matamal of course tigel adang rigel skogi ariri drom gel skogi mengaria program adram rigel wasen dia adril oit mengar adril monge osi gertir mengaria ngartiar langal ngaramdala aurore la mara ramdal selmle quarira PNQ rangaramong ngarangamalal el ngaria skogim le crusher sera forsa atemela magmat en ngaria te del soldar diri mata taurior lo siga abadingir ya cuma kada mongal tati kada matigertir kada masa ilmu tel almora atrungal gartir ablu ramreget kada ngarse man mumala swar wase maran tirga iloi taklangar tirel tira klangar tira miloi tel defender kaldo gurits malam tira adel tira they gave their lives defending freedom. Marana ulang seadel kira belul michuting ngara michuting government asayidel delegation tiger betokal adel tiram not magala namoy taklangar til girera atelungir kangal gida kira al sel al sils el mimokle edogurits el belu gadamran maringa sulir dior hotel sel el medel del willer gid ma ablu ramrigen Akora di ngarse yide dirigan morsel gida of course ang albangaled makadbol all seems like every week gadim sa kadrin tokora covid dirigan gida ngate alemran menga soda bro amrel malmol molon se orgit maul gada sel baqal mera al silse of course doctor hen kaga obanged maka faran momskida details ra ma ukure redra agiret al pandemic di sogal almo دولية كده الأدر بلا مرال غلطات كده غلطات التغل الأولى كده غلطات أو تنا كده مرال وسع ربق الديوسا ممكن تنطر بالواث من اللقري ده ومسكيدا وميل ولداسو مقدر مين تيجي راب الواث دي سلا قلت الكلول كان تنطر بلانو الأدر بلا سيركل تارين قرا يقال بايا مال كلو تطلع يقال التقوي مع الأوكل غاري يقدر هذا بلا مال بالأول لو مسا قال بارجي ده غاريا مسكو غاري ما عمل ده لوت كيا كراجل أشياء قال ملا البلو ويلهلم برونسولا عمله تلولجيس أكل من ناريا سيرمونيين مساعدن قال مساعدين وسا مسكو أسل اللورالين مرال ملا قليله اللي ياكلوا مرو لا يجر لورول دي سيل سو مونغورا اموريا اجينغاول ملو مغاريا او ديغل ان موتمك نسيا او تقل تارنغا عمرال وسا اولا بلا ال السين سنسيد الواسين قدغوت الكلويل دويسرا السيرا بلو الادر جيدا ملا فاكسينيت نسيجي دكل تارنغ الدوبان من نسيل كل تارنغ راول داسوم قد موتمك واسي أجاكيد الأورا بيرابلون دي تيجي دابا ضروري نقدر مسبع أخري ده أو مسرع رجال البلاء ملبوضة بري أو سيجي سير قط تروني رال بضا ذاك يوجي سيجي الكلتار رجع مالي مسك توتو تلل ترى ترجال هذا المنار تيجي project recovery أنكلا دكتور بات سكان أنا أقول نقاش وقت شيرين كا يمغرا بيبولا بارج إلي موستوريين واسه كمية مالنا تنتر أدر بلاو إلين سيجي الكلتارين أنا أولين إلى السيلسين سيادل أنا أرتياج يمرور تيالور رامه لكم سلب أكله إلين سيجي الكلتارين أنا بلوه إنسان الكلتارين لون وسير منستري أهل مر أدار منستري أهل دمرال بلغارن دين مرور دوريري المراجع كربا بالسبرير ما أقول قدر سلب أكله من أكمدين واسين البابير أتايمه كمية هذا مدير أدار بلون دي هذا البرير تيجي هذا رورا منستري أهل ده منستري بطورة أمدور تيرا سه بره غريا قوبيد الأنغار تيلان ده بمري أجي كذا غير هذا الموسموك كم ده سه مرينغ مرال هذا لانغوك لما sometimes سه مرينغ رايك تيجي الفاميلي سه تيجي مرينغ أسولير سه كذا الديرة كلامريا رينغ تير ما بلا رينغ تير بتيجي نير أدر بلاو ما أقوله تدري lo aklangar tir in harm's way hindi tibtigan diri gidel protector gidel keep us safe makadam ring asulir ako minakti am doso tigel soldal ni laklangar tir tiga gida ar soldar el al mangara ablur belaw maulet tial rakta de qabel sis معلومه قد سلب عقل لا على السلسم قد مرال جيدا من asulir segidel al كلامريا رينغ تير ما بالتيجي رينغ تير مرة أدر بلاو تير عبك السيلس لو ريل الوا السولدان من غرب الوا من أكتيمو كمية جيدة باي نوا ولانون مسا غفار مع دكتور هنكاك بتبعي مو أي سريدة يجل أوك current cases مع where we are and then by open gire la guerre manger seguida adedran gire 11 o'clock sula
Sulang Mr. President, malungil total morga vice marogul ministers adra media ngartia rogul adlo mes oring sirtial press conference. Akti yomu le President meringa sule la Dr. Hancock. I want to thank you, Dr. Hancock, for joining us this morning and for being with us another week. Certainly we've accomplished a lot since you arrived last week, and we continue to rely on you and Dr. Cash for your recommendations and advice for our response. So thank you first and foremost for being with us still. Akti omu'lo maskida updates sa rigel cases. So mlani nga first release at tilob dara eli da afternoon al-quradi umakatak rigel details at tirigel terul positive case, material close contacts, manggel imong wal probable case il mildang ara airport. So tirigel terul positive case last week the dillo sir the isolated till 10 days tirak guidance sa CDC test out til hindi gimnom tigiringil was sira after 10 days ang wal ko dir kang aringi a positive result regal test tir magi mi lingit ra Dr. Thay na maguk miskita ku guidance sa testing based test based criteria ku release ra ar adal positive so gilmutel mo test tir elang malmon lo mes tir hindi klok tu telel do dangali o sitirgal adam sisi abdangir diakal se ora require au grul o sisil timing wal tamaral mo diakal bukuy sa lo mes test result tir hindi kada malmol mildi tablong guys ral selbelaw ngel mildang airport kita mle start ra testing ra Sunday semle weekly flight magdang 120 adam larsel skogil may le test ra airport nga gidel wana wal gura mlaringa positive antigen aringi mang ngemle dimlar airport tagingun mara isolation facility marko lilut test ringi ra kotulurior matutar eli egel test ra Monday matutar eli adim negative ra rogui including ra antigen wal blood release and diakal gaze di segidel group na test ra report amle positive Dr. Thena sabel wa motelgibel kumakal masada testing lasing ngara ul mamluway sing tirigel 26 close contacts tirigel two positive case 22 tira amla released amla test negative ra day 10 tadi mede la tewang al mol ngara quarantine al mungir cell day 10 testing di so far tirigel rogui including tirigel 4 negative test ti so mal at may warung dal gilet saying walo otil was indim lakal yu letial dirgakal dim lakal yu letial al raqt al murti kay gidil first al 22 mutamla release tay gida mal mol lo message tirigel tewang test tira day 10 al week mal sugo man negative at the released from quarantine agi direct l'Oriolo mentira adra ministra education ma private schools al finalize el school mitigation plan so agi mombitra klugo agi le sendering mora rogul school including a private schools matuguk mesang yang aniate elilo mas kama comments til girel sel school mitigation plan so the deadline el alsil ma Ministry of Education nakampile kay gidel comments sa Gilbekel School yaklugo kay meet the finalizing hopefully Friday at the earliest then sa Eltob da kora finalize the endorse el plan sa edel isil morabela rogir ma parents tuguni parents madingelo sa maldir ko klase bakreng gidela arangal kara school mo yolingita sa bas kama el alweek emro ko sa mamel ut makli sa gidel plan e budo o ay siringin more other abalu. So thank you Minister Education for the collaboration. I think early next week we'll be able to roll that out other especially for the parents. So kung da sila adigay kita sa idol update lang direct komeng last omrus madingil wasing ladir nga niya Malders tal adil Belarus Sera Friday Padra Friday mlanya idil dartel at over 300 المقلول هذا مع adolescent الململارا first dose ngora ngil ice اللي قدم دنيا لسر هذا ديرك مرايل مملار اوروس last الباث اقلوغوك ديرك مال ديرك قن اوروس سي المير اقلوغوك را national gym radolong lela 2 p.m. mo 6 p.m. and then the Pfizer dorus ngira akluguk so dirigal remaining el 12 and older el dirigal bel nga orus sa sabiin merak luguk ra at 2 p.m. mo 6 p.m. Direkal gi oriolo mentrit dirigal private clinic doctors sama direkal toktang hospital identified dirigal el giril malar sel third dose so gi dirigal oriolo mentril kan parse gi the list use edel merusara selong edel dose el mortirgel moderately malut severely immunocompromised and the so adel magat clear sel at time and dirga bodo rose sel booster shot say so da dirga mangira toera a CDC lo asengo ingrang in sa edel mo start the roll out ngel booster shot so akmadingela sing adirekal la tobra a news ra blul adel waseg da expect segid and the el time dirga qad borsay ndigi di mo o message dirga gidil immunocompromised to start lo masteri se long edel dose hopefully starting next week. Dr. Thay, do you want to add anything? Maybe just explain the positive case at the airport and then why we've released from isolation.
And why we're all holding the other one. Yeah.
The initial cases and why it's past the 10 days and we're still holding them.
Okay. Yeah, thanks, Gafar. And thank you, Mr. President, Vice President, Ministers, media, and of course, all of Palau. Appreciate the opportunity to be here and collaborate with your team as you guys put in place those layers of protection to really help protect Palau from the Delta variant. So the question in regards to first the case at the airport, as you, sorry, it's always better. All right, thank you. So looking at the screening at the airport, we are working with your ministry to maximize the protection of Palau, knowing that there's a lot of Delta variant transmission outside of Palau, and how do we best identify individuals who potentially may be infected with Delta variant before they come into the country. That's one of those layers of protection. And so last weekend implemented the airport testing, which I think is quite valuable for Palau in that it allows you to get a rapid test on somebody once they arrive on island. So you're hopefully able to identify people that may, for whatever reason, be shedding virus right when they come on island. And so the fastest and easiest test to use in that setting is the antigen test, the Binax antigen test. And so we have utilized that in the Palau airport last weekend. We did identify one positive in the passengers that came in by that rapid test, that Binax antigen test. Now, as you folks may know, unfortunately, no test is 100% accurate. Sometimes people may be positive and the test says they're negative. That's one of the reasons why we have to run multiple tests and ask people to restrict their movement when they arrive in Palau. Sometimes the test will say somebody's positive who's negative, and that's why for any positive case on the antigen who is without symptoms of COVID-19, CDC recommends confirmatory testing as well as your MHHS. So once that individual was identified as positive, out of abundance of caution, move that individual into an isolation facility. So if he did turn out to be a confirmed positive, would not further expose the community, while confirmatory testing using PCR tests, which are more accurate, but take a bit more time to run, were done. And with those confirmatory tests, it indicated that this individual was negative, and therefore that test at the airport was a false positive, which can happen. And he was then transferred from isolation into the standard traveler restriction of movement, and then will undergo additional testing. So as we move forward, as one of those layers of protection that you have at the airport, you may, from time to time, identify people who are positive that confirmatory testing shows that they're negative, and we may find individuals that are positive that are actually positive. In regards to the other cases, currently in Palau, folks are wanting to take a conservative approach to clearing individuals such that the risk of transmission from a positive case into the community is quite low. CDC has recommended 10 days as a standard cutoff for people to be in isolation. As long as they've recovered, they're considered non-infectious and can be released. As these were the first two cases in Palau, there was interest in looking at utilizing the CDC test-based release criteria, which is a bit more conservative. And therefore, what that criteria requires is the individual waits 10 days and then has 2 negative tests greater than 24 hours apart before they're released. And as these were the first 2 identified cases in Palau, Ministry of Health felt that they would prefer to take the conservative approach at this time and ensure that those individuals test negative before they're released. The reason why we don't, CDC does not recommend test-based release consistently for individuals is we have found that with these sensitive PCR tests, there are individuals that can shed remnants of the dead virus for a long period after they've been infected. They are not infectious. These are sort of the broken pieces of the virus that remain there in the nose. And so it's hard for the test to distinguish if this is a viable virus, a virus that's intact and can infect people, or if it's sort of the broken pieces of the dead virus from your immune system recovering. And because some people can shed these remnants for months, CDC has moved away from requiring test-based release criteria for everyone and has instead relied on the evidence of the duration of recovery. So I think the Ministry of Health is well aware of this evidence and will continue to adjust the isolation requirements if they use the CDC duration one or the CDC test-based release based on the situation and resources at hand.
And I think one of the things, Dr. Hancock, that we're kind of familiar with is we had those first 2 cases back in June that we tested, and I think at the end we confirmed that they were historical. So maybe you can shed light on that.
Absolutely, Mr. President. Thank you for reminding me of that. Yeah, you guys are familiar with these folks that are persistent shedders and can test positive with a PCR because of your 2 historical cases. That other testing seemed to indicate that they were not actively infectious, but rather old infections, and those tests were picking up those remnants of the virus. So thank you for pointing that out. Well,
yeah, let's start with the question and answers.
Today, Mr. President, Vice President, amal di Minister Setial Rogir. Question nga Presidenta, kautal mo na meeting, adi mo na question nga. Kadamlar meng sa news out of Guam. Luwasay CDC na place ra Guam on a very high risk. Luwasay tuwalol ka ba araat man diaklo o fly mo ra Guam. Kitial ko radir ka masada Aikel mo trigal immunocompromised kada man Aikel third dose 13 malubeng kada dir ka mira temela booster shots. Magera wasay el always say kita teletar el time ya belaw dir ka ngarnya a flight ringa Guam el may. Nguangarang akora responder gitu gil kaya itu kalau esel terletak rakwa menel alam lamun ya high risk ngi kita tidak tahu ngi la temela dongot mo critical immunocompromised other way.
So, like ma kafar, kama Dr. Hancock answer your question.
So lang nakambes ra malungil ke. Awerak kulingit ra Dr. Hancock kamulgora maskita asya singra situation ra kwame. Akum da setegi dia awul makadamle implement tayagi the additional measures including ang testing ra airport upon arrival. Saygi dilli raw was at closure, whether it's borders, malubong ng school, malubong mass gatherings sa mga rangaw. Tingira lultur saygi dil all badabal wasing kodomes ra capacity ro hospital. Of course, saygi malmol monitor a situation ra kwam al sugumuguk mangal mo ko ra risky, and then sa edel ko komes ra atara strategy hindi el atta me umral wasay blada kutmokla aurior mang da malmol maloba saygi di hindi kita malmol malomes ra situation wasing malmuang ram. Of course al sugum perta askogi ra a Sunday etiro ko di positive, it's gonna change our strategy in the umdasula sa ila time itel blada kutmoklia as edrul tuiringi for now. And then maybe Dr. Thane just perhaps shed light on the situation in Guam and what are the cases like and the hospitalization and things like that.
Victor Lee cell level 4 sa other mosois brakwam. By recommend that say lakabe molding le ngariate le malungutia rakto. That's the purpose of that. Di gida ukayel level sa protection gida of course kada tester tirural me. Tester tiral gerda border gid mong. That's our countermeasure. Ding wal recommend say ali omem turakwam ngariate le malungutia rakto. That's what they're warning people. I mean, I think that's what the level 4. Dr. Hancock, I was just trying to say that the level 4 is really in a statement that says we don't want you to come to Guam because you may get it. I mean, that's what it's. There's a high probability you may get COVID in Guam, but for us, we're saying we're protecting ourselves by putting those layers of protection in. Testing before they leave, testing upon arrival. That's how we protect ourselves from the threat. But please.
Yeah.
And we're vaccinated, so that's
Right.
the biggest protection.
Yeah, absolutely. So yeah, I think for the level 4 travel alert notice for Guam, it is really about for people who are traveling to Guam to have an understanding that they are at risk of getting infected from COVID-19 because of the amount of transmission in Guam. But I want to point out that across the globe, Delta variant is pushing a lot of places into those areas of higher risk, including the rest of the United States. So it's not just Guam. I think in general, there's quite a bit of transmission outside of Palau. And so this is where I think the importance of really putting those layers of protection in place for Palau is key now. You have good layers in place currently, and remaining flexible and enhancing where need be as you guys, as you receive additional information. And just to reemphasize, the key layer of protection that Palau has, which is really unprecedented globally, is the level of your community that's vaccinated. That being said, I understand there are individuals who are eligible to get vaccinated in Palau who are not yet vaccinated. And I just want to reemphasize that if you are unvaccinated, please do get vaccinated. The Delta variant has made vaccination even more important than it was 3 months ago. It works remarkably well at protecting you from severe illness and having to go into the hospital and potentially death. So that is why we really want to reemphasize for individuals in Palau who are not vaccinated. protect yourself from Delta. It is very good at finding unvaccinated people, infecting them, and causing severe illness. And we're seeing that in Guam right now. The number of cases are extremely high. Guam has 80% of their eligible population vaccinated. And so you can think there's way more people in Guam who are vaccinated than those that are unvaccinated. But the numbers are about 70-30 of unvaccinated cases to vaccinated cases. So it's still primarily in the vaccinated. And when we look at folks that are hospitalized, just the other night in GMH, they had 24 folks that were hospitalized or in the hospital for COVID-19. Of those 24, only 7 were vaccinated, and of those 7, they were all older people with comorbidities, the majority of them. And so it really helps to show how the vaccine is helping protect a wide range. Even those older individuals who are hospitalized, they're not nearly as severe as they were in the last surge, according to some of our Guam colleagues who are working in the hospital. So again, just to reemphasize, one, if you're not vaccinated in Palau, go ahead, try to get to one of the pods, get vaccinated. It's going to help protect you, it's going to help protect your family, and help protect Palau. The other thing is, mentioning those vaccinated people that are in the hospital. As you may know, we've talked a lot about this additional dose for people who are immunocompromised. And so I would definitely encourage individuals who feel that they may have a weakened immune system for whatever reason to reach out to their providers and look at getting that additional dose to really boost their protection against COVID-19 with the vaccination. And then, of course, all of Palau to really think about when these boosters come out, the opportunity to really enhance your own immune system's protection against COVID-19 and the Delta variant when it does come out.
Mr. President, if I may ulit Dr. Thane Hancock, mal share a story when you agi mle an isil mle mitra Dr. Hancock, and he told us about the story of people who were unvaccinated who got really sick even though they were healthy. So you can share it with the media, because I thank you for sharing that story with members at NEC, because it really brought home to me why it's important that we must vaccinate with.
Sure, yeah, thank you, Vice President. And I think this story is not from my family, but a colleague's family in Guam, and she shared this with us. And I know that unfortunately in the U.S. there's many stories like this, I think from family members that have been impacted by COVID-19. But what really spurred the story was a question about can we protect ourselves from COVID-19 without the vaccine, but just by eating healthy, living healthy, sleeping, and just having our own healthy immune system. And what this story, the vaccine is the best way to really get your immune system ready to fight COVID-19. And this was a story about a family whose one of their uncles had a stroke, and they all came to the hospital to be with their family member during that difficult time. And it included individuals who were vaccinated, but there were also 2 family members that came that were not vaccinated. These 2 family members were extremely health conscious, ate healthy, were fitness folks that exercised all the time. But unfortunately, when they came, they did not know it, but at the time they were infected with COVID-19 and the Delta variant. They unfortunately spread it to the uncle who was in the hospital with a stroke, who had been vaccinated. They spread it to all the other family members as well who were vaccinated. But as we mentioned, the Delta variant can infect vaccinated people. What they found was, unfortunately, fortunately, the uncle did okay despite his stroke, but he survived the infection. The other family members had mild disease, when they were tested. But those two health conscious individuals who were not vaccinated had very severe disease. One wound up in the ICU, and the other went into the ICU, and one unfortunately passed. So this isn't, this is just one story. There's many stories, but I think, you've heard me say over and over again that I think vaccination is really that key foundation for protecting yourself against COVID-19. But as we mentioned, nothing is 100%. So adding those extra layers. Certainly eating right and being healthy, add an extra layer. The other things that can help is, especially depending on the situation, if COVID-19 arrives, thinking about making sure you social distance, you wash your hands frequently, wear a mask. When indoors, think of ventilation. All of those are extra layers. And there's one other extra layer that I would like to bring up and share, if that's all right, that's available here. And I think people have heard me talk about it, but these are this monoclonal antibody therapy. So this is a therapy that's been authorized by FDA to really help reduce the risk that somebody who's sick with COVID-19 gets worse and goes into the hospital. It actually helps people feel better after they receive it, and reduces their infectivity as well. Now, the key with this therapy is that you have to receive it. It's targeted for people that are high risk for hospitalization, so people that are older or obese or have diabetes or lung disease, and they get COVID-19. Before they get really sick, we want those individuals to come in and get this therapy. And that will reduce their risk of having to be hospitalized by 70%. So that's another layer. We would like those people to be vaccinated, but if unfortunately they are sick and they're not that sick yet, it's within the first 10 days, maybe just a mild cough, still come in, because we find that people who have severe disease tend to develop it about a week after their initial symptoms. So I want our community in Palau, or your community in Palau, to be aware that this therapy is available. It's been provided by the U.S. government to the Republic of Palau. And it's another layer of helping protect the community. And so, in fact, is that all right if I share with one of our patients received it and received the therapy and reported resolution of symptoms and improving. So it's already been utilized here in Palau at this time. So I think this is another thing. It does require the public to be aware that it's available, and collaboration with your provider to be able to access it. But yet another layer of protection for Palau.
And Dr. Hancock, while we're on that, I think one of the concerns is with the Guam flights. Of course, we have the children, 0 to 12, that are unvaccinated. So I think it's important that we share, so what's happening among those children in Guam currently, the unvaccinated population, it's spreading. How does those young ones, how are they, what's the prognosis?
Yeah, absolutely. And so I think we get this question every time from your astute media and public. Hey, you emphasize vaccinations as being the key way to protect yourself, but we have a large proportion of our community that we care about very much, which is our kids under the age of 12 that can't be vaccinated yet. And what can we do to help protect them? One thing that we're finding, again, is that fortunately, COVID-19, even the Delta variant, does not tend to cause a large amount of severe illness in children. They can get infected, they can spread it, but again, it's rare that they have severe illness that requires hospitalization. And in fact, in Guam during the current surge, it appears that I think, right now in the hospital, there's no children in the hospital with the surge. And there was, one child, I think, that was in for a day and released. So all the hospitalizations in Guam tend to be older folks, and especially unvaccinated older folks. So it's reassuring that Guam is not seeing a high level of severe illness in their kids, despite the amount of transmission.
And then I think the other thing that we heard this morning was even in Guam, transmission between kids at school was not high. And maybe you can, yeah.
Right. Yeah. So folks, I'm sure may be aware that Guam shut down face-to-face learning and is transitioned to online learning. However, and they're doing that to try and slow transmission, but it was not due to identifying large clusters or groups of infection in the schools. Guam had implemented systems to protect the students in schools based on CDC guidance, like the Ministry of Education and MHHS are collaborating on right now for Palau. But they did not find large, a lot of transmission within schools. I think I'm not sure exactly why, what the governor's exact thinking was, but for closing schools, but certainly with that amount of transmission, I think they're really trying to reduce it. And again, that transmission tends to be driven by unvaccinated individuals, so that's why the shutdown.
And then they were saying it's coming from home, is where they're getting it from.
Right. So, unfortunately, the pattern that we saw previously in the pandemic and are seeing in Guam, especially with the appropriate interventions in the schools to limit infection, is that kids don't get, usually if a child is infected, it's not from their class or from a student, although it can happen if people don't follow recommendations, but more than often it's from home, right? And so, I think as you guys can imagine, when you go home, you're with people you trust, and your guard is down and you're together. And unfortunately, if somebody unknowingly has the virus, it's much easier to spread at home than in a school.
Yeah, so, and I think that's important because, we had, when we first had this announcement, the absentee rates went very high, and people are holding their kids at home because they're afraid of what might happen at school. So it's kind of like the airplanes. People say, well, airplanes are closed, transmission is maybe high there, but it's not, because they have good filtration, people wear masks, so that's not where the transmission really happens. And so I think it's much higher at karaoke bars, for example, because they're singing and other. So those are the things that we have to be more careful with, and I think that's important to help, because the response by taking your kids out of school is part of the reason why you have to close schools in Guam, because then there's nobody at school, right? So. Yeah.
Right, and I think we mentioned this before, and CDC really believes that the well-being of a child is more than just being COVID-free, right? It's really about getting an education, being able to thrive and grow, and this, as we shift to sort of dealing with COVID-19 over the long term, we can't give up on educating our children, and so looking at safe ways to ensure that our kids are able to have access to education is quite important. The other thing, if I may, just to highlight one of the enhancements of the restriction of movement for people that arrive on island from Guam. Now, they've been vaccinated and tested twice for COVID-19, are negative, but we are asking that those individuals, or the Ministry of Health and Human Services is asking that those individuals do not interface with children less than 12 years old. And the thought process or rationale of that is because they are your unvaccinated population in Palau. And until somebody has cleared the restriction of movement, we are asking that they try to stay away from having close interactions with those kids so that they don't inadvertently spread the infection to their kids because they are the unvaccinated. I want to highlight that that is going to be hardest for your residents that return, right? It's not like there's a lot of divers that want to hang out with with kids under 12, but I know for family members returning, that may be difficult, and ask the community, to have patience and follow this guidance to really help protect that unvaccinated population in Palau.
Thank you.
Mr. Presidente, congratulate the government galbis Minister of State, Mr. Gustavo Itaro. Mr. President, namoptokal time in announced na city al COVID-19 na anti mo mangeder kay rabe kilsils. Mangeder the mo kill nga rabe is a new normal. Elabela 86% of population of Elamla are fully vaccinated. Ngari agar hospital ngari ya. I got testing. Tangani adra blue loger na say. Ngogiwa gagidel facility na morngi ma preventive measures. Ngoing ra time ang mosabe del korawal ta dan create tial COVID-19. Mang mosabe del maral kel diado mo tletele kal flu. Mang mosabe del implementa gagidel el preventive measures gidamru ela dum diaktal gobidra. Nganya ko ra guidance ra CDC mal ubeng tal government mo ngoing ra time and sabe del mo announce lo I say. Marado ablo among denget nasir. Kada namo tiam lamo aflu.
Yeah, Malungula Karim, Mr. Talamse, and I think this is a good question to ask Dr. Hancock. I guess the question is, when do we think, we're saying this is the new normal. When do we think we're going to reach a point when we would just treat it like the flu and go back to not having to wear a mask, just not testing? I mean, is that ever a possibility, or is this our life going forward?
Yeah, that's an excellent question, and unfortunately, I can't predict the future. No one can, but I think that is as Palau cautiously moves forward and is looking outside to see what is happening externally with the virus. I think the real goal is to build that national resilience to this virus, such that you folks are implementing interventions that allow Palauan life to move forward and move on, yet showing resilience to the infection. And potentially that could show up as having reducing the severity of the virus because of the vaccinations, and where it's no longer the threat that it was months ago. And you guys have already done that through your vaccination process. So again, just to reemphasize, for folks that haven't been vaccinated yet, do it now. Don't wait till there's community spread. It takes a while for the immune system to build up, and then for those of you with weakened immune systems, really look at getting that additional dose to help boost that protection, so that Palau can shift really into that that position of resiliency or being COVID safe moving forward.
Someone summarize?
Thank you, Dr. Hancock. So, lo sa niya tokta nga kasi kada malmol maru lay gagil doru del at time ngora mas hindi kat sabail low ice sing radu borak lugong ada ka adal sabail hindi wase kada malmol mutmok lay gagil dor maru lay gagil doru le malmol lo mesra ay krel belaw lo sing warat tetel ngarak esay ding nilu tel maklat kergi do se tegi del orus tegi dia agire del gut makli emla gut makli hindi tirigel dirga lorus pelo nga orus egitel kuk mu oltaw terselong ede lorus el mortirigel el immunocompromised misel voltemel en direct lungil dot makli segi dia adul waseng dom di deringil lo meser segi telela klangar el mut el goramo waya klangar raw el before when itel el pandemic ending way say agundaseng gira del di klagare o mesringi edi malmol mlamo truim al buil dangat tegi dil el state mong understand ra adra bulul wa segdem lamo masaul togar adem lamo masaul rindil di masadra ko bi di madakte kabam magidi rekending at sugum kadam na survival mel al silsen sa beed el luktakang le kaingisew kauklat ke el malmol metke o mesringi segi dia kumdas segura
Mr. Trump sa dos maklo tutula garim angira drama saigal baby rablu ame sase material vaccinated ang wangara atretelir amigre atto wangara yitian mla iso sa kwam trial mla vaccinate taman makasay tiyan mura guru dan amigre lang manimisan makasay ay da gira do mes malmol mes tial plan ding close to trabo do mes kidam la mula yel gira del remul el protector ngari oy ngari trial baby la diriga nga aurus ada beberapa sensor gitu dalam lama dokter itu set diol ada kalau ngilo lari na paiso kalau tel tel dire kan bisa dokter hen ka tel mong kosmodise mong ada da mo understand mase problem diol and dia kam dokter la tel arus ke dokter hen ka kaino we were meeting with the teachers and very few teachers principal said very few teachers have not gotten vaccinated, but one of the groups was ones that weren't that were either pregnant or were breastfeeding. And maybe you could just share a little bit about that. So,
thanks, Mr. President. I think it's an important point. And, I think, I hope folks understand that throughout this pandemic, CDC, many different parts of the U.S. government, as well as our global science community is studying this virus, studying interventions to try to slow it down, and studying the vaccines and really monitoring the vaccines to ensure that they are both safe and effective. And certainly we're in a better place now than we were months ago. And one of the things that's new that CDC has recently released is, if you may recall, when the vaccines were first released, they like all medicines, we were a bit more cautious about giving vaccines to pregnant women. Based on how these vaccines work, there wasn't, it seemed like it would be safe for pregnant women. But the initial studies were not really designed to look at giving the vaccine to pregnant women to prove its safety. But as you know, pregnancy happens. And throughout the studies, there were a number of women who were vaccinated who became pregnant. And so the initial evaluation of those women and their outcomes seemed to demonstrate that the vaccines did not impact the pregnancy in any negative way, and in fact helped protect pregnant women against the severe COVID-19, because we found, like many diseases, unfortunately, being pregnant puts you at higher risk of having severe COVID-19. And so there was some good early evidence that the vaccines were safe for pregnant women and actually were beneficial in helping prevent severe disease. Since then, as you know, over 170 million Americans, and that includes Palau's numbers, have been fully vaccinated. And CDC, throughout this, monitored the outcomes of pregnant women who had received the vaccine. And they found that actually the vaccine, were not able to identify any adverse increase in adverse events related to the vaccines. And again, the protection of those pregnant women from severe COVID-19 was extremely helpful. And so because of that, CDC changed the recommendations. Originally it was, if you are pregnant and you feel that you're low risk of getting COVID-19, you can discuss with your doctor and decide whether or not you want to wait till after you deliver to get vaccinated. Now CDC's recommendation is, hey, these vaccines are safe and effective for pregnant women, and if you are pregnant and not vaccinated yet, we recommend you get vaccinated to protect yourself from severe COVID-19. So that's a change. We do recommend that pregnant women get vaccinated. Again, with the Delta variant hunting down unvaccinated people, I think it makes good sense. The other thing that CDC has recommended, and really from the start, is that women who are breastfeeding do go ahead and get vaccinated. There's been no adverse events related to breastfeeding. And of course, breastfeeding is one of the best things that a mother can do for their infant, for strengthening their infant's immune system and health. But the other thing is that they found that women who are vaccinated and their immune system makes those antibodies to protect themselves against the virus, the COVID-19, is actually secreted in breast milk and given to the baby. And so it's a way that a mother can actually help protect her infant by ensuring that she's vaccinated when she's breastfeeding, and in a way, and she's helping share those antibodies against the virus with the baby to help better protect the baby from COVID-19 as well. So, new change for pregnancy and continued recommendation for breastfeeding mothers to get vaccinated.
Summarize.
Thank you, Dr. Stein. So, ala tokta nga wasing time ng CDC abay yolingit ardiol wasay mo alsum dira ka morus ebem morus la mo nga radar ta ma okuwit el milyon el adra amerikel ul demokrabela Michael el USAPI samla nga orus tokot tira diol lati le ka kura adverse reaction malubot ako ramal hito el atar el morangal el lorus mong bay malukol sa el time ng bayungil ardil diol el belunga orus el sugo mendirga kalunga orus direct kalunga sadra tut el wasen direct kalunga suwirang kalngal ka sugo ma aadila tut nga orus en direct ligay del antibody wal soldara padingid el tegi del orus marula al sabatengit direct kel sel volum tutrangal ke ngoyu den morangal kam direct kel kukso kliangal kam dia kel vol se erangal raktem seguida agora ti kede pel lomso de la orus el mora ardiol mar adil lom tut
Mr. Clay.
Adalutun bisata ko bitel tilgibi. Malong ito presidenta matingala sa ngariya sumiling kara sa katibal time makmo ask the question le kor ka wedira kal kulingit makas kay kelwes ta questions sel marabe kal minister sel kuk ngariya kare kal mortir wala pon mereka press conference matingala sa ngariya micronesian president summit el kautal ni announce el basing moringila klugo kumalang yawas mang akira sa ngara taregel ngara agenda el almal kora global cooler el pomosado mi president ra micronesian country apod ngila sing ako bitatarak maklol tokoy ma dal etc PIF tingwa ti so dal morong si sa ngara sem kora klol common issue kami masado ngilang makti askar semen seringi poregel restrict questions
Ang white say area of course ang area PIF ang area COVID hindi tara so adala tel tokora transportation na drone legal belum magradoli siri skog transportation am lidiul madavo ngaray gel se adal kaya se ornil especie lidiul se ado donil basen help para geiza help para legal belwado kita mau mengikat el belum beberapa time oleh diul ati tua kola, saya kita merur oleh diul mau ngira terus lagi belum, lagi masih ada diskusi, saya fokus el tiagi del forum, sudah, dia bisa ya.
Kemarin sulang etik target question kalau registrar, ati awan question tiang mutul ma ministry ya, mora maybe mora kau material mora kafar understand lo sa ngani Pfizer niya mo expire al September 3rd dire kalak alwi de ngani ti ka komitian masada sa kum screener tirgel mora tirgel immunocompromised mo malar sa lunge de lorus kera asi at sukum tamilaya mother night sabihin mo malara Pfizer al ubang sukum dege kang adi oital sukum ma-expire September 3rd sige dawan na question kuk next question na mora kami ngay kamal kapera tokol partatel belum mal kakarosing imahel hindi question na mora minister at matul ginela tirgel ngara 300 madaling idal adal tirangatel program na cross actor lang lak alwide setara priority ra kamiwa o siga amot already ra pol marektel cross actor sila ilalpoila September ma question na say ngarakora plan sel kiri kabelmentang absorber tiro ku ya lu ngarakora plan ra ministry kiri len dire understanding im beto kar adangot al bulul dire kal schedule den bumarala al sila ka table time tara question na ku mura minister agriculture and fisheries, you're not getting away with no questions. No, question ko ka era turobis ang yaklol concern era other abulul kidela kuk tokoira pickery babi. Asing mal diga babi diga tanem wal gora dimeral mo maringla tosi ka babin mo regal mal betokol masangal albangala. Makera sel albla lutul mornya flight tel mora Taiwan ngani akora urior el kirela ekegidel tokoira babi mal di last one amora minister finance tiga WIO era last week amne report to lo say ta momalar sel payment tra SS ya understand lo sing SS amla authority sel total mora WIO hindi question lang sel kuk kaniyar atal tiyo mo katong lo kelo si kel kuk mlora HCF iken ngara of the swil kirel ngari atte alertir el mong ma kelo tutir mal ubang ngara tir ka pending el kirel se kitel part of payment. I hope ay galgari ka omlilo sila hindi across the world hindi kay kita kaman misulang.
So lang ilera question. So sen ko talaga mo sen sa bela adal ngilo mother na kuk mamala Pfizer. So kita diol tirak laigel EUA igel emergency use authorization malubong approval ra FDA. El atta may gaya kal kangelo sa edel mix vaccines. And along the same line at tirigel mamala ong edel dose mamala mother na li omisindra ang maklol other bela sa do mo umrus ang ila mother na mamala mother na sel ko kong erul gari milgiri lagel mo expire el Pfizer o maral nga niya doses mo expire September 3 se wal tele la cold chain na ul mo expire hindi ka dadulo sing wal din madel mo o expire tetele la kadul top dem la thaw out mong wal gira dalo spare amre at the time ul mo expire hindi tal madang ilo sa ngania skogi ma umro sa kluko kung direct ka lang niya second dose sa el alwi kung ayel mo o taringel expire gira di mo itindi ka hindi kluk to talala ato tang liya sa ayel dose pe el vaccines moving forward al di dollar CDC mandabol bigik klar adra
gimnara cholera tutaw tulo ay sa gidelo sa ngaria supply mal di moyor gidel kada estimate was entera bodoru sertir order en me umra lo hace seguidel dom bodoru hace mora immunocompromised o mora September 20 why say
dia ka cell immunocompromised na mo sa edel lo by cell booster mora rest priority group around late September
so immunocompromised can start now and then booster. And then I was just sharing that in the call this morning, they said there's plenty of stock. So if people are concerned about, we just have to order and estimate how much we're going to be giving out, and there won't be a problem with the supply, right? I mean, we're getting the community to understand that there's supply. There's no shortage. So.
Malungil tutahal ko kung irsal tokora prep. Malungil akri me lay.
Kale baidik dilungila namuri kalmo te presenta na momil madik wate ale kigang emorgo til close eko bomo isra burde ada adila sel so kadulisen se kananga covid maral waise Mr. Terlams kita gira del el help para da mo understand se te anu normal a covid o banged de morgo lo banged kada magida malmol man murula yero gul gira del murula المسبة أقرأ بلوم مقدم ما أندرسند رسال سبكرين أقرأ بلوم قدرون يترقل تارين نتوسع تول مول ملتمغل غاين سو تنكرج هذا تقول دقيقة أوروس بونا أوروس عليه 170 مليون الآدم لانغور أمريكان دقيقة لما سوسين عليه عندي ديل الكرام كيت التلملل o ingari artedel adal nosbel milar sel J3 sel blood clotting, but other than that yidil adal let's say ngari raktel ngari ngaranga amno vaccine and they're okay mang cedro sea the protector ablo de sea first line of defense egida amru la yer rogul dorul el test monitor emsu continue adjust and make sure abel wada sel bak magadoli te sel kartareng I know roseng mo toka raureng I think taraboloruni ka farma Dr. Henga kan mutel mo to dara kapsing rakto ora dias since 7 o'clock. Please encourage our admiral direct call in and ask a question. Les ya close to the round so to close to the seguida kada share information and moral information ta kali nga Facebook lo adi moral tulo di moral information donito ase to durtura ada Ministry of Health and Human Services material expert gida umra lo setial التقوية مرغولو بنجات دي كده دي موضوع الميك شور كده سلبا مرالو سبيرا كلتار نغرا بكلاد مسولا نموغي المرسل مورا ميتينغ ماك مرال تريغامال دي مول دي ارتيان for the next تيمس كميا update next 3 weeks activus of course vice president ang artian marogon ministers كده مورا UN الموتل مي من ويسيجيت tirigal mal so bagano di war beklada lek mengari ang lega tirigal vaccinate kada kada mo apply sige the rules so asen dega dangar bitar mi kare ngalaga di insegit gira dal mal mol mer ke amru la gira dal marun mang sulang ma makme ay redor mol me minister to
okay alwa isep sula presidente halak paska bebir o urele ma quadritral enject algalim an so al first tak announce mutel program gukti odor tirak lalla eng mo endra el albuil yas kuma olbil gukti sa dal continue ni sa guk mal de moyor til fundra program di up to now gimla abro el time amiru al millas melon mo ser trigger rogul ngara pa pandemic employment el mrula resume ertir mang omisin tira mal dim la katal resume tir mlemring kamam oltaw tira urior maurior up to date tagimna of the 374 al made al active ngara payroll in 326 agim lamrula resume tir imna stat al transition til mara private sector ngani kombalil giblam sen daigal circulate ang clearer other possibly sa ilmo sigaurior mangani arm la hire tir mara construction jegal moms kuma detail urior di targi moruni ala gidele division of employment services amalasam mal streamline or self process ra adra hodal bulu mal sumong mornia adamiul gora ame renew malu bangania adang ra outside el trial may egi first el seldori day seldora losiga ready other velo agi practice in all time coming magi encourage ra rogul kombali may el may gagi dalis trigel viable applicant el sibil hartil other velo asku mukti gal do ulelo ngatmo renew malup tahan gel adra ngodal bulu sida process el gimangi dimbay sekal by askra minister finance mo ko makael ko masawda gal to raw do asku mani gel gilalaw do the program I endra as far as I know endra al physical year sing mo gera gera ko
solar selger lera tora babi gagi daguk ministry motmok al malasam al adresara disela malgela babi ilmu available al mura addressers al time ngarinya di 10 legalom el l'including la blila issue tastagar aralel at least ngarinya imol babi lom el once a month mong babi mararinya so elom el 3 times a year dito asing mal mo stress ang albabi mo sa igel cook ethics ra to kora armen to sa dilom el 2 times a year say yawan ra ngaringin el all time mong so idel expect al adi tenel ngalgela babi imal babi alom el average 10 to 14 asing average ang atenas so idel to ra 1 month ngaringin selurior el diregal expand ra blila babi mingira permit equipment del moso mamal cleaner sel era nekken namru la design rabila babi se selam qatmokla moso bedel estimate ngara 450 piglets del doctor al selatarra dirigal effort dirigal wasing tangarian adra sersel ngari armil sab edelo no ser tiria mo breathers mo ngal mo to babi so ndigal sal isura wasing no diaga skogim no diaga sab edel masimen almi amle isyung gel adlul mella amle stara tawang gem la mem no statlom el egida ngaria igal borol ngartiam mo dos pe egida wail gada mo ula esel tanera babil merbelaw ma egida agora ministry mo tmokol malasam lom doisa idisela ngalgela babil mo available mora farmers mo Dios pero understanding other group mo sel al time an average centena sab edel lo tobdra al sel talvule o malasam increaser say agaskara mora la toksora kapsangi ma días mal sugu mangaria el momsadra togra babi I'm sure mutul mos modil mobla takla ngania kariren sab il gol el mongeng mutul small idere el invitar other ngania interested tirwa se lemera nekkeng melesa operational al time mal facility se main constraint ma ulum da sab edlom dois of tol babi
Sebagai bias kerana follow up pertil anggar oral boran. Next question. Again, before lo sa tagal to na babi, letter concern and raise ni adal tira o individuals tira o babi. I say rather than ministry marurak lo babi o ela babi. Ngaraman dia ka mo sa kaltrira malumang nganyar ato already to babi kukpol breeders emol sis akatir el malgerel di to spera adal ngarat Taiwan al me breeder gal babi al umang nganyar lele del technology as el transferring in mora tirgal kuk private operators mo sab idel kuk breeder babi ul terangaragal ka challenge el ngarsay kita el mo mister ngila
malungil gare sel di do ase gdom el rabavi gdo qorom dasolo setia mal di simple el toy di sel selectringel lungil tanel mabalom el seya agotel gora godel dal el aspect telurior el al time gdora mrurungil sel di sel tobda tanera Taiwan atamla selectringi mal megda sengaya ungil tane el al time Diaga laboratory rigidel sab eder mal maigal simen rababi o mes under microscopic maigang mal healthy ma dos pe maral mo ngilang galbabi seya seba krel wasang sab ela adel mom leba binding swadel moringi cell capacity rigidel mara adel wase self selectra tane gamral selectra ngil tane seya dagal sab edel di so of course adel mo sab el inseminate rababi sab el ngidilad di cell selection ngigidel tane diagal gora mal biotel di da kasing idil ada sab eruli mong sea process el gimalas man marunga gimla rotator other livestock mende adilo rula gale langi le apa ara babi lo mwada babi te dirigan la mospenda at least Tuesday Wednesday nekken el ngarsel training of course es el facility al bol dor ya siabala dirigan momrura la con el momodor a livestock laboratory some motlgibel ngaria ability rigidel ngar segidel gora laboratory partal selectra igel mosob el nyam gil tanel mo produsa angil babi sulang
Minister of Finance.
Thank you, Lei, for your question. And regarding the Cross Act, it's our intention that we are able to continue the program through at least end of December. So this is something that I'm working on planning. My understanding from discussions with OEK is that they are also interested in the same objective. So I think once the budget is passed, you will see additional support for cross-act activities through the end of this calendar year. Regarding the WIOA payments, from, or reimbursements from Social Security. We have received some funding from the Social Security office that's meant to reimburse people for deductions taken from their benefit payments for Social Security. We are waiting on WIOA office to verify the accuracy of those figures, and then we should be processing the payments to the beneficiaries from the Treasury. Regarding the HCF, I was told that there is an inquiry to U.S. Department of Labor regarding whether or not these payments would need to be returned. It's more complicated for HCF to return the funds than it is for Social Security. So that's where the information I have ends. So that's all I can offer you for WIOA.
Oh,
Sula Chief of Staff, Temora Minister of Finance, Dimdela 1 month in Labs Tial budget 2021, in Kikina Vessel budget House of Delegate considering. Assembly depending sell additional 20 million loan ng ADB, ang condition ng amne girel mo ngada passage sell tax reform bill direct ngara house. Agi mo rin sing most likely hindi abol kangay a house at kaya the tax reform. Ok mo hindi abol kangay ngari although that sebel ngoy gidra budget 2022 lo mo October 1st din mo.
We expect that we will have some savings from our expenditure controls this fiscal year. Some of that can be used to support the budget, but as you know, we only appropriated 90% of budget for next year. And the understanding is if we are unable to pass reforms like the tax reform proposal, we may have to look at some austerity measures and reduce expenditures further in FY22.
Sula Minister Udoy Temora Minister Matule Minister Malbatol Adar Foreigners Lurior Belau Amla todo Rablur Belau El time Makla demand Radlo Sig Radlo Urior while Salgegre workforce available Matirgel gimo spare tir ngara urior assess agimo mesa tir metokor tir amla mora construction mang mamla mo expensive adoru la urior assess el que spare radra Bangladesh ma al mutul baby ra ngari agora uldasul government amosabel malara radra ngodul blun me olgi setial ge chargi legdam le ultuir tir gaigidala Muagelul ko Minister Victor Alastak mungire da mege gogi del transition el Moses Secretary adar bela el Mosabril ngaragal uri rases rawera di do to the tritegar adar rogui le lang mali misel kloadi mander tir mtan lamo laba dudil morba lamo mring ragmama afford ni ngaria gorol de suela government el girel tiang
al sugum ka malungil agrim sadoy al sugum ka maldi focus ra addressers sel so kal clarify ra agrim sel do addressers en ter other low commercial farm other ter maasel nganiam gegrel sersir ler maasel nganiam gegrel sersir ngarat rule dart madrangel etrigegi da rol mangarak lang disab elam asal afford rangil 1 day ngania 6 days el kultob del mamrula sersir ter mga skum commercial farms alak alwithin mandi makasara o dea ka register del shares itrigelo shares alak alwithin makasar tira actually omgorola del lomel del angara livestock. I think I need to look at the data selm those shares makam specify ra kalibot pung commercial farm adang individual kora adalos pengil house boy
sa sula minister kalilungil pom tifen rabulgula commercial le tiragi del masel lurana igal mse iga dire lo spel mega udotni e o spel om gartira vehicle sales men dior po sel government tak mo commercial telak lungi lau do the revenue so is e gamiak musegi dia kamasya tirila 200 adal mas tirila igi dia un makdam ngakaler bela emna mo miring kamam o sigar adra Bangladesh el merula el igi del seselo lo spe tirila igi del 200 tala como gara mo sugumam mo sebela aigal tirgal adra urel do spe tira igi mang modiak el sal tagay Hemos mamá la Ford emergoy aigal el masay masay samgro le tila gidi amal nitr gamamrela
til amring la gugen rigin la gira la minister mafel mo masaud ringil el alta ngani 900 el adra Bangladesh belaw emira la 19 ragot ngari 17 marar sometime el September Omsin de trigel uka record ramam. Omsin de trigel rogul adra Bangladesh el mlamertial program el mo transfer. Omsin dem le house boy. Sorry egmal right and sorry el construction and clodo. Le omsin del time tergam so gairul dar taklu grabuil. E betoka complaints el since go raise ni betoka complaints el mer obis len modega ududir modelo lo makartir ma ultimo mangarakal mo si gaurior makikita kero ka challenges er gamamra obis real time makrada balance ra ududel ang galaad ma selbakle laklang aringi mutlagi del molgoring lorior asers leng sel okol sal mal mo yasu adira utmo misa model sil survive seguida challenger gidem
mo ise minister elangani alla el farmer el ngani atul ral el farmer el asabel depending el $150 a month maglel bayung il mrelli agora babli kirim alumen meeting el gaw mabol suba mam lego appear matamiwe em helper gamam masem garat solve el problem le tiri lagi del 200 el mas el morgortir tiri lay aldum gadam nga gukauma adiokan endi mam lamom kasar adal Lorio Raika. Ma al sumun sebele mo misa record gamik mo tangaral Bangladesh family farmer elat tangara construction. Ma lubet tamla transfer mo rangodal. Letang osisiul maintain osisiul numbers and din la change a jabertin mo rangodal. Lorio. Le katokor omesek mong magarak dangoy titiradra ay krebela al memang mo sebedal la Ford urana gal mgegrel uriol doru
I think mo a challenge ergi de sadoya osigra adal willing el musugra dar bogi maklu murul el agi del uriol molgo len sel do mesa huri ping a standard of living anamral morba para adana mo expectacle do gal ma wori ergi di moral mo wila igana miringi agerak mo ko willing el musugra dar bogi maklu ngara sers ngani am asar bela willing el musuqa dar mo game club ngana ser gila dalik el uko ger gid mo gid gad willing ngar segid el standard of living ngara mring lurior tika dere galo si gal du ule lak langar tira ngoriak kada gora balance ngil ndia kal mugula dollar adal mei agar ngani willing el member su murur segid lurior for that amount of money a month a year segid a challenge gid ndia kal am lorim ra adal Memorial merura sers el dart mogi maklo grabuil ok pol atil ngatil se der klisi el ngala I hope pendak kalwid ndi
di last kali ke shakalo gara question mo ra Minister Education Minister Jenkins you got into office last week sworn in so what has been your first order of business since you got in
There have been more than one. First of all, I wanted to thank Gofar and Dr. Hancock for including MOE personnel in the committee. It was a really strong learning experience for us. What we found, based on what we learned there, is that COVID has taught everybody a lot. And one of the things that they've taught that we've often overlooked is the importance of face-to-face contact in schools. And so the committee, we're developing what are called mitigation plans to enable us to, one, prepare and protect the children's health, And secondly, keep the schools open as long as possible. The obvious layers of protection, such as the vaccine, the face mask. We're also including in that the spacing in the classrooms, the facing of the tables, many little details. Ventilation of the rooms is another important issue. MOE has been working on another project for the past 6 months, which is a hand washing project through funding from JICA and the Japanese government. And that project is now ready to be implemented now in the central schools in Karora and Irai. Basically, what it has done is we're going to enable outside hand washing stations all around the campuses, so students don't have to wait to go to the bathroom to wash their hands. They can do it, wash their hands getting ready for lunch after playing. And those also have included in that project the installation of over 100 hand disinfectant stations with the materials to do that. So that's one thing which has been right on top. The other, which I had planned on, but really didn't realize the mitigation plan was so far underway, is to reallocate our human resources to emphasize back getting into the school classrooms. Obviously, the interaction between teachers and students is a critical issue. We have significant numbers of teachers who have little experience and little education to enable them to teach. So what we're doing is we're working together with both the directors to take our specialists who are highly qualified and qualified not only in basic educational degrees, but also qualified in specific subject matters. And they are going to be used in the schools to work with teachers who need assistance in either general methodology, lesson planning, et cetera, or in terms of future planning. And this is all part of our professional development plan, which is everybody has understood is an absolute critical need for us. And in that, we'll have the specialists in the classrooms. Not only does that benefit the teachers, but it'll also benefit the specialists, because they will be able, for the first time, actually to see how the curriculum is delivered, what works and what doesn't work. And it'll give them a much better idea on how the assessments need to be developed to meet what curriculum has been delivered. So those have been the two main things. On the other hand, I just wanted to point out, I can't believe how the warm welcome I've had there. Everybody's been very helpful, very pleasant, and it just really makes you feel nice about being there. Once I learn all the acronyms, I'll be a lot better off. Thank you.
Thank you, Chief of Staff. Medi guaisat mungkita Speaker House of Delegate. Ari adam lego lenil girela budget. Ya House of Delegate tamla pasra budget. Elangara Senate tamla passing ra first reading man. Timle Suriara dal boloning loading set press conference rela. Command sula.
Lambodia kakarmiar adra media. Diyan. O madaktiyo ay sila se abay sa Minister of Finance ang nga meeting artit. In fact, ang Minister of Finance al amo mitlo bantarira adra House girela adra Senate girela budget. Ya Minister Obi ang tidak kaldim lamra ilal kuk mo set girela igel libong kating ma groundbreaking al afternoon. Era bodo do bora ligaratan shobi dito recognize ra Ambassador Sid ngartalo banggit ang nilutal kiel tal Sunday mitilo bantarira members ra diplomatic corps mitilo bantarira adra kabalmentra era lora ra Sunday mora New York mangat moklil girela tripra presidente mora UNGA madilungil basule do bora igel tan shobi mel alsil se ndiswa de lowrang ra malungil tan shobi mora Teyim al-adra kabalment mga niya Iris ngira mangyor ra MOE Minister Jenkins one of your staff ma Chancy Useluku ra Ministry of Health and Human Services morendinga ra Ministry of Finance Marian Clio Kasuma ra Health and Human Services ma Franz Abalos ra Health and Human Services el direct malungutan siya Bill Mortir kadamra nga suliral girela ngilurerir and we hope they enjoy the personal holiday at sila po ngay mada tilungil basulia press conference kita timerit yang merokong mal masula rokuy.
Adalo ese chief of staff ko mal misulang enseguida maulong la press conference rigid di bogo ay so se ter press conference halong mok ni ang relbelaw lo bangela PNCC ma PWFM ma TMC TSM lo mesra rerun ring rakap singay logi wa PNCC Digital TV Channel 25 madirekal PWFM TV ra Channel 24 ma TMC TV ra Channel 38 di mo seguida mal saular beklad boy di olgin mora station rigid ng relbelaw ra miunsa ko man sulal beklad. Have a nice day.